Good morning, everyone, and welcome to our Medicare Made Easy broadcast this morning. Now, this is a regular Facebook Live broadcast that Blue Cross and Blue Shield of Louisiana hosts to share information about health topics of interest, especially for our friends who are 65 and older. This is the last Medicare Made Easy broadcast we're going to do here in 2021. So really important for us to share some tips with you to make your plan choices during Medicare's open enrollment that much easier. We really appreciate the time that you're making to join us today. Feel free to drop us a thumbs up or a smile emoji in the chat to let us know you're listening. If you have questions at any time during the broadcast, you can also drop those right into the chat box and we'll answer just as many as we can online. And any that we don't have time to get to, we'll definitely answer and post after the event if we run out of time. Now, for those of you I haven't met, I'm Mike Bertaut. I'm a healthcare economist with Blue Cross and Blue Shield of Louisiana. I'm really blessed today to be joined by two experts on Medicare benefits, Ann and Deborah. Let me go ahead and introduce Ann first. Ann Booth, are you there?
I'm here. Good morning.
Good morning.
So I'm Ann Booth. I am a Medicare specialist with Blue Cross, and I'm thrilled to be here this morning. I've been with Blue Cross for over 6 years, and I love helping our members and people that are not members currently, but we would love to have them as members. So people that are on disability or our seniors who need help knowing more about Medicare.
Thanks, Ann. And the other half of our powerhouse Medicare team this morning is Deborah Smith. Go ahead and introduce yourself, Deborah.
Hi, everybody. My name is Deborah Smith, and I have been in the Medicare industry for 22 years, and I have been with Blue Cross for over 5 years. So needless to say, I absolutely love what I do, love helping Medicare beneficiaries, love educating people on this very complicated topic, but things change every day. It's always evolving, and it just keeps us moving and shaking, and I absolutely love it, Mike, and I'm glad to be here. Thank you for having me.
Oh, it's a pleasure. Listen, Deborah and Ann work very closely with our Medicare members. They're going to share some of the common questions people ask today and very smart answers. But first, I want to go over with you some of the key dates we have coming up. First of all, this Medicare annual enrollment period for health plans is going to end on December 7th. So if you want coverage on 1/1, make sure you make your choice by December the 7th. The coverage on the plan you choose will start on the 1st. Now, Ann, what advice do you have for people who are on Medicare now to let them know that they're making the right choice? Because we've got 750,000 people in Louisiana on Medicare, and any of them can change plans from now until December 7th. What kind of advice could you give them?
That's right. So it's only 22 days away, which doesn't, gosh, we have Thanksgiving next week, so it's not much time. So the first tip I would say is don't do it alone. You can call a experienced agent like Deborah or I, or other people that are on our team, and we can walk you through your options. That's what we're here for. And the number's on the screen, but it's 1-800-568-1417. And we also have the website up, which is www.bcbslaplan.com/Medicare. And there's a lot of great information. And then don't get overwhelmed by your options. Just ask for help. That's what we're here for. And our agents are available every day. And there are agents right here in Louisiana. So we know what your parishes are. We know the different doctors. We know the fitness centers, things like that. So we're here to help you with that. And there's no cost or obligation to ask for help. and have your questions answered, because we want you to feel when you walk away, you are comfortable with the questions that we answered for you. Always say we want you to be an expert when you go talk to your friends or your family. And one of the best things about working with an agent is that you have a relationship, not just during enrollment. And so that's part of it, that we're here for you. And our Blue Cross agents are available year-round to make sure that our members get the most out of their plan. And we have resources to turn that you have to, so you can turn to with any of your questions. So I'm going to give that number again, so that you can call and speak to a licensed agent today with no obligation or cost. So please call 1-800-568-1417 from 8 a.m. to 8 p.m. and that's 7 days a week, or visit www.bcbslaplan.com/Medicare.
Excellent.
And
This
then
is, go
Deborah, sorry,
ahead.
I was going to say, I think Deborah has some really good tips too that she can help people that are watching today. Oh, Deborah, I think you're on mute.
I am sorry. I didn't want to interrupt with all three of us here. So yes, I do. And thank you, Anne. That was some really good information. So what I always like to reflect back on is what we advertise a lot here at Blue Cross is the 3 Ps. Of course, and it may seem a little overwhelming, but the 3 Ps, of course, stands for providers, pharmacy, and plan value. So when you're starting your search, you don't want to have to uproot and change all of your medical records and who you're working with. So the most important thing that you want to check first is to make sure that your provider is in that network and that you have adequate access to care. Because if you don't have enough doctors to choose from, even if you need to find someone new, that can of course pose a problem as well. So I always tell people to start with that. And if it seems a little bit overwhelming, those numbers that Anne gave you are perfect. Call one of us. That's what we're here for. We're sitting around waiting to look up those providers and those medications and things like that for you. We can help you look for those things and make sure that those doctors are in the network. Now, another thing, another P is actually pharmacy. So you do have your prescriptions that you have to fill on a monthly basis. Sometimes they can be a little bit more expensive than others, but you want to make sure that your prescriptions are covered and that you're getting the best price that is available to you. And again, what a lot of people don't understand is that you have closed formularies, open formularies, you have 5 different tiers of medication, and every company doesn't have the same exact tier. So you want to give your prescriptions and make sure that you check to make sure that the tiers are the same and how much your cost sharing would be with that particular company. And that's what we do here at Blue Cross. When you come in, we have a concierge service. We're going to look up your providers. We're going to look up your medications. We're going to tell you how much they will be when you go to the pharmacy. So you're not, caught off guard when you go to pick up your prescriptions. And of course, last but not least, the last P is plan value. And this is all the little extra goodies that you get, like the gym memberships and, our telehealth service and things like that. And of course, there's different rewards programs and a lot of different things that you get. And these are considered extra benefits because they're outside of what original Medicare covers. And these are just things that are out there available to you that you are can have access to. But call in, of course, to speak one of our representatives. We can review these things for you and kind of see how these extra benefits can kind of enhance your lifestyle.
These are really, really great tips, Deb. And I want to say that, I can't imagine why anybody, even in this day and age, would want to just pick out a plan on the internet when they could pick up the phone and talk to one of y'all that, have been doing this for years and it backwards and forwards, and you're not going to let somebody make a mistake and end up in a health plan that their doctor won't accept or that doesn't cover the drugs that they need. And those are very real possibilities, right? When people are shopping. So it's critical, really, that people look at plans that cover the doctors and drugs, but also have a premium they can afford and consider the out-of-pocket costs, right? Because everything, copays, deductibles. Deb, can you explain a little bit about that? Maybe clear up some of that for us.
Absolutely. So I always rave about the 3 Ps, but the next best thing that I always tell people to look for is what's called the MOOP, and that stands for MOOP, and it means the maximum out of pocket. That means the most you would pay if you had to have a catastrophic event happen. So as long as I've been in the industry, that's usually the first thing that I go for. I look for what's going to be the most out of my pocket if something really, really bad happens. And a lot of people tend to overlook that. They may look at, okay, what is the, MRI copayment, or what's an office copayment? But really what you want to make sure that you have is the bigger picture. What will happen if something catastrophic were to happen, such as cancer, stroke, and situations like that? And a lot of people, again, think of the basic care of the preventative services and things like that. But when you're looking at a plan, that's probably one of the questions you want to add in your questionnaire is, what would be my max out of pocket? And make sure that you understand that this is different than what a deductible is, because a deductible means this is the amount that you have to pay up front before the plan pays. But a maximum out of pocket means as all of your co-payments accumulate, the most you would ever pay at the end of a service would be the maximum out of pocket at the end of that year. And that could be at any point in that time. So if you definitely want more information about that, please give the agents a call. We can just, explain that in more detail to you. But again, it is your maximum out of pocket cost for medical and hospitalization expenses if something major happens.
Right. That's a major comfort to me. I'm in my 60s now, and I'm thinking about what my life's going to be like on Medicare, and the notion that I can get a hard number that somebody can give me and say, Mike, if you're using in-network care, which is really easy to do on a Blue Cross HMO or PPO plan, because the networks are huge and broad, then I know I've got a hard number, and once I hit that number, I'm out. Basically, the insurance company is taking care of me as long as I'm staying in that recommended service. That's a huge deal. Let me go ahead and check. I'm going to check our chat boxes here and see if we have any questions from the audience. Let's tackle this one, whichever one of you guys want to take it. It's if I'm 65 or older, but I'm still at my job, do I need to sign up for Medicare?
I'll take that. So no, you do not have to sign up for Medicare. You can wait until you're ready to retire. Then you can get on Medicare. If your company is still paying for your insurance, then you don't have to get on Medicare. And that's a question a lot of people ask, and they worry about it. They worry they're going to have a penalty and those kind of things. But if your company is still paying for it, then you do not have to sign up for Medicare.
So Ann, can you comment, and if not, that's okay, but can you comment about how that might affect my dependents if I'm still working and say I have a spouse that's on the plan?
So it's going to depend on, basically the company. If they're going to take care of your dependents as well, then they don't need to worry about it either. But if they're not going to take care of your dependents and they're age 65 or they're on disability, then they can go ahead and get on Medicare. But if they're going to take care of your dependents, then they can still stay on the plan as well.
Very good. Very good.
Yes.
Deborah, I want to direct this one to you. Let's say that sometime next year in 2022, I'm going to actually turn 65 years old. When can I sign up for Medicare? When do I have to sign up for Medicare?
So a lot of people know of the 7-month rule, or also known as the ICEP, which is the initial coverage election period. So depending on when your birthday is next year, you're going to start 3 months prior to that. And another misconception is people think if my birthday is on the 15th, then I can enroll on the 15th. Everything starts with Medicare on the 1st of the month. So you're going to go back to the 1st of the month of your birthday, and then you're going to go backwards from there 3 months. And the first of that month, of the 3rd month prior. So let's give an example of, let's just say your birthday is in July, and July the 15th. Well, your Medicare should be effective for July the 1st, and you can enroll and apply for your Medicare 3 months prior to that, which would be, I'm lost from my months here, April the 1st. So on April the 1st, you apply and you can start everything. And you can even enroll in plans like Blue Cross as early as April the 1st as well for a July effective date. And then there's a couple of things to note though, is that one, if you're turning 65 and you have enough quarters, you do it on April the 1st. But if you're already drawing Social Security, then you do not have to apply for Medicare. If you've worked enough quarters, if you're eligible for it, then Medicare is going to automatically enroll you in Medicare for the 1st of July if your birthday is in July. But I always recommend, it doesn't hurt to just touch base with the Social Security Administration still within that 3 months prior, just to make sure that you understand how much your Part B premium will be if you have one, or any other ins and outs when you're approaching that. And then again, we're here to help as well. I'm always educating and doing Medicare one-on-ones with customers. So even if you're far out, still give us a call. That's what we're here for, to kind of give you the guidance and get you going and get you in the right steps in the next direction. One thing, Mike, is if we didn't have another question really quickly, I wanted to touch base back on that employer question.
Yeah, definitely. Go ahead.
Sometimes I get misconceptions with COBRA. A lot of people feel like if they are coming off of coverage and they have COBRA coverage, they feel like it's credible coverage for Medicare. And one thing to note is that if you are still working, or if you're retiring and you're wanting to stay on your employer group's insurance, as long as it's credible coverage, then you will not be subject to a late enrollment penalty. But if it is not credible coverage, then you still may be subject to that penalty. And COBRA, in all instances, is not considered full credible coverage. And that's a misconception that gets people in a lot of trouble. So in that particular situation, I would also advise that you call an expert and talk to one of us about it, even if you just have basic questions about it.
Well, we dealt with COBRA a lot more in 2021 than we would have normally, because the Fed was paying 100% of COBRA for a pretty big population of people all the way until the end of September. So it sounds like what you're saying, that when I turn 65, if I'm on COBRA, I can't stay on COBRA and use that to put off the penalties. Is that what I'm understanding?
You got it.
Man, my head is going to explode. It's really good. Thank you. Another question that we got was, we have somebody who may be watching us who lives outside of Louisiana. Can we help them?
And you want to come on?
Sure. So our plan we are Blue Cross of Louisiana. So we are in Louisiana. A lot of people think we're affiliated with the other Louisiana companies. So, if they would have to be a resident of Louisiana to get our plan. Okay. So when we put in the application, they have to have their address in Louisiana. So unfortunately, if they don't live in Louisiana, then we are not able to set them up with a plan. Yes.
Okay. It sounds like our normal individual for under 65's coverage in that respect is that you have to have a Louisiana residency to actually purchase a plan from us on healthcare.gov as well. Sounds like it's about the same thing for Medicare Advantage. Okay,
well, and the supplement also. So they would have to, because it goes through CMS, which is the Centers for Medicare and Medicaid Services. Yes.
Not too long ago, I was sitting with my mom and her neighbors. They do this thing where they go in one of their front yards in the evening and sit in lawn chairs and chat about what's been going on in the neighborhood. And I happened to be visiting her when they were having one of these yard chats, I call them, right? And of course, they know I work for Blue Cross, so they always have a million questions. And some of the ones that are not quite on Medicare yet, but are, on their way to Medicare, asked me this question. So they were like, Mike, I don't understand what the big deal is. Why do I have to buy a supplement? Why do I have to get on this MA stuff? Why can't I just take the government straight Medicare and do that? And can you give an idea of what the real benefits are of purchasing a supplement or buying on MA, and what the differences are between them? Just a small little question.
So I know, I was like, that's a lot. So it really, whenever I get this question, and Deborah, she may have a different one, but, I always tell them, just because your friend has one plan or a family member has a plan, it's different for everybody. So I always say like a Medicare Advantage plan is like a package, because you get all the little perks in it. So you're going to get dental in there, you get, with us, you get vision, you get prescriptions, so you're getting a little package deal in there. Now the supplement plan, you get to travel, they have doctors that accept Medicare, but you have to get a different dental, you have to get a different plan. Like if you wanted to get, your drugs, you need to get a drug plan with that. And then if you want to buy dental, you have to buy a different dental plan, you have to buy a different vision plan. So that's not an all-in-one little package deal right there. And then a lot of times, people want to travel all over, and they like it because there's not co-pays in that plan. So it's different for everyone. Everyone's situations are going to be different, and you pay a monthly premium on that. Some people don't want a monthly premium, so it's going to be different for everybody, truly. And that's why we always say call and speak to an agent. That way we know your situation, and that's why always it's good to talk to people about that.
That's excellent. Deborah, earlier you were talking about MOOPs, max out of pockets. How's the MOOP and MA different from the MOOP if I buy a supplement or if I have Medicare, straight government issue Medicare?
So if you have original Medicare, there is no maximum out of pocket. So that's why I always tell people it's best to choose one, either a Medicare Advantage or a Medicare supplement, because original Medicare is not going to have that stopping point for you. It's just an 80-20 split after your deductibles. Now, on the supplement side, Ann did very well with describing. One is an a la carte system where you're purchasing everything separately, but on the supplement side, you're paying a monthly premium. And for the most part, it's picking up the majority of that 20%, depending on which one you choose. So the maximum out of pocket is not really into play with that, especially if you choose, like, say, a G plan that's going to pick up everything after deductible. So there's not necessarily a MOOP for you to worry about. But people who are wanting to try out the Advantage plan, it really comes into play because the takeoff that you're getting is that you're going to be paying co-payments, but you don't want to have this exceeded amount of co-payments going out the door. So that's where the maximum out of pocket comes in as that insurance, or as I call a little safety blanket, that lets you know that if something does catastrophic happen, you have this limit there in place to help you out if it does happen. So that hopefully that kind of explains across the board the three options, either original Medicare supplement and then, Medicare Advantage plan.
So it sounds like to me, if I really want a predictable maximum out of pocket that I might have to spend in a year, then Medicare Advantage is my only real option to have that number locked down.
Absolutely. I would say so. Sure. I mean, you can do it with the supplement as well because you're paying those premiums, but you also have a lot of money kind of going out the window, regardless if you go to the doctor or not, as well as an option. And I see we have some more questions over here too, Mike.
Yeah, go ahead. One of them is, what happens if I miss the December deadline?
Okay, I can go ahead and catch that one. So there's also another election period that comes up called OEP. And that is the open election period that allows you to make a move from January to March of 31st. Now, also another thing here in Louisiana is that we've had so many disasters. There's always multiple special election periods. I know we're beating a dead horse by saying call in and speak to a representative, but that's where we can kind of outline and find out if you do have any eligible special election periods available to you out after the December the 7th deadline. But if not, for sure, you definitely have what's called open enrollment period, and that's from January the 1st to March the 31st, that allows you to make a one-time move if you weren't able to do it during the annual election period.
Okay, that makes sense. So if I wanted to compare different Medicare plans, what's the best way to do that?
And you want to take that one? I don't want to hog all the questions.
It's okay. So, for us, we only work for Blue Cross. So we can only speak for our Blue Cross plans. So, you can go to Medicare.gov if you want to look at other plans, but we speak for only Blue Cross. So that's what we would talk about. And I know a lot of people, you know, they'll call in and they don't realize that they don't have Medicare Part A and Part B. So to be on a Advantage plan or a supplement plan, you have to have Parts A and Part B. So a lot of times we're educating people when they call in, well, I didn't know I needed that. And how do I do that? So we are helping people with that a lot of times when they do call in. So yes.
You
And let
know,
me add that they can go to Medicare.gov and do a comparison, but my recommendation is that still call the individual plan to make sure that you're checking that information that's on Medicare's website, because they are compiling a lot of different plans and a lot of information. And sometimes some verbiage is kind of missed in the translation of the information on Medicare's website. So you can go there to kind of do an across the board to find out what's available for you at Medicare.gov, but definitely reach out to one of the representatives at the individual companies just to confirm that information and ultimately enroll, so you have that connection with the company. So if it's Blue Cross, definitely call us, verify the benefits, let us go through it with you, but you can do a comparison on Medicare.gov.
And
Excellent.
some things are missed on that site as well. There
Right.
may be information that is missing that is not on there also.
Okay, this is good information, really good. I think the number one concern I heard in the yard chat about Medicare and about really insurance in general was how their prescription drugs are covered. I know that we've been working very hard to create lists of drugs that are so valuable to our members that we offer them for zero copays. Is there a zero copay drug list for an MA plan for Medicare Advantage?
So we have, I guess the best way to explain that is, you know, we can look up the medicines and they can do it on our website, but it's by tier. So like our tier 1 medications are a $0 at our preferred pharmacy or mail order, because we know some people still want to go into the pharmacy, but they can't, so they can either go to the pharmacy or they can have it delivered for those tier 1s for a 90-day supply. So it just depends. We have about over 1,400 medicines that are a $0 for 90-day on the preferred list for us. So yes, so that's why it's good to call, because we can go through their medications and help them with that, because I know it can get really confusing sometimes.
Yeah, you know, I read in the news yesterday that the cost that the government charges individuals to have Medicare are going up next year. For example, the Part B premium, which is about $148 this year, is supposed to go up 15% next year. And the deductible is going from like 202 to 238 or something like that. And when they were trying to explain why they needed to increase the cost, they said the majority of that cost increase was due to covering one new drug, one that may or may not work for Alzheimer's, right? So, I mean, when you get into an MA plan, what I see is you being embraced by the security blanket of an insurance company who knows what they're doing. When it comes time to cover health insurance, our plan's been in constant existence for 88 years, 88 years in a row. We've been offering health insurance in the marketplace here in Louisiana. I just don't think you're going to find a better set of solutions than that. And we want to make sure that you guys can take care of it. Well, we're really about at the end of our time today. I don't see any more questions in the box. Are there any last things, Deborah, that you would like to offer to the market before we finish up?
No, I think we did a really good job kind of outlining everything. I can just say that, again, there is 22 days left. December the 7th is the last day for the annual enrollment period. Definitely use those phone numbers to call, do some shopping, ask the questions. That's what we're here for. And of course, Mike is probably going to give you our little updates on being able to see these videos again in the future. But that's pretty much it. Thanks.
Thank you so much for being here today. You did a wonderful job. And I hope we could do it again. And how about you? Any closing comments or thoughts?
I was just going to say, please make sure to reach out. That's what we're here for. We want to get all your questions answered. And, we are a resource for you. Don't feel like you have to do it alone. So we are definitely here, and we want to make sure that you feel comfortable with getting your answers for you, and know that Blue Cross agents, we want the best for you. So yes, that's all.
Excellent. Thank you so much for being here today. Listen, if you have more questions for our Medicare experts, please just drop them in the comments. We will watch for them. We'll keep answering questions even after the broadcast is over. As I mentioned earlier, this is our last Medicare Made Easy event for 2021. But if you missed any of them, the live, or you want to share the events with people you know who are looking for Medicare plans or who could benefit from the information, we have posted video recordings on our Facebook page and on the Blue Cross YouTube channel, which has got amazing videos in it. I'm sorry to say I'm in a bunch of them. So go take a look out on the YouTube channel. That's where you can go to see our Medicare Made Easy YouTube playlist. So you can actually get a list of the videos and know what's out there. The channel also has videos about a bunch of health topics from our doctors and our nurses, our clinical health team. And you can subscribe to it so you can get alerts whenever we make a change or whenever we do anything differently out on the plan. So I really appreciate you guys joining us today. We're going to drop information on our other upcoming Facebook Live events in our comments now, so you can take a peek. You can see them there on the screen. We're just thrilled to have you with us today. Go ahead and click going and share the events with your friends if you see anything someone would really like to know. Thanks so much for joining us. I'm Mike Bertaut, Healthcare Economist at Blue Cross, and I appreciate your attention and time with us today.
Thanks, Mike. Had fun.
Thank you.